My name is Michael Brown, Mayor of Grand Forks.
I'm Steve Gander, Mayor of East Grand Forks.
We're aware that the coronavirus is presently in North Dakota.
And also in Minnesota.
And our communities have been preparing for this event for 4 to 5 weeks, and we think we're well prepared.
We challenge everyone in our community to operate with good logic, with good facts, and not in any way to succumb to any concerns beyond that. Let's stick within what we know, within the facts that we have. You know, someone might say it's a bit of a challenge to coordinate between 2 cities, 2 counties, 2 states. But in fact, what we see is we have an opportunity to look at best practices between those 2 individual groups and bring it all together to the benefit of our residents.
North Dakota Governor Burgum yesterday gave an excellent briefing on the COVID-19 situation in North Dakota and gave excellent guidelines, and we are following those and we're discussing those with our local health partners.
Minnesota Governor Walz also gave some guidelines and parameters that can help to mitigate the risk of the spread of the disease. The greatest among those is to avoid large groups and gatherings, including a lot of the events that would have been scheduled that are now being canceled. The idea is if we all gather and all spread the disease amongst ourselves, we create a bolus of cases that will overwhelm the healthcare system. If we stay away, if we stay clear, and allow it to penetrate into our society a bit more gradually, it will be that much more manageable by all health facilities.
Our objective is to prepare, contain, and mitigate this virus so that our communities will have the least of negative impact. I echo Governor Burgum's call to act on facts, not fear. What you can do as individuals is frequent hand washing, stay home when you're sick, and avoid those most susceptible.
In addition, we can clean and disinfect frequently touched surfaces. We can cover our cough and our sneeze. We can practice social distance whenever possible.
It boils down to personal responsibility. We're aware of the economic impact this has on employees and our citizens, and as information becomes available from the federal government, we'll pass that on.
Absolutely. A lot of the work that's being done at the federal level will help to offset these costs. And again, our communities, the cities, the counties, will work really hard to disseminate that information to our residents.
I've asked for daily updates from the Public Health Office.
And we're making plans for the continuity of operations, particularly public health, emergency response, and public works.
We're following state guidelines from the governor and state health board.
And we have tier 1, 2, and 3, which were in the press release, and you can look at those in great detail.
Ultra has created a health hotline and directing all individuals to 701-780-6358, 701-780-6358. They have nurses handling the calls in conjunction with physician direction, and 2 paths of low and high risk are based on screening criteria and will make arrangements for testing if deemed appropriate.
We've asked our health providers, what is the capacity to handle a crisis such as this? They've indicated that the capacity is very good and that they have a willingness to cooperate with county, state, and federal officials in the reporting and testing.
We also know there are questions about closing schools, and these are very difficult decisions. And again, those decisions will be made in consultation with all the local partners. Schools want to keep open due to the workforce, particularly public health, emergency response, and public works.
Again, as a community, we want to focus on preparedness, not panic.
Please follow on local media for updates and our city website.